When Lisa Kelly was diagnosed with leukemia in 2006, she got a taste of the growing trend in the hospital industry, patients paying cash up front before getting treatment.
Like, well, what if I don't have $45,000? And they said, well, for you to come in, you're going to have the $45,000.
Mrs. Kelly was able to borrow that amount in time for her appointment in December of that year at the world-renowned MD Anderson Cancer Center.
So we were leaving the doctor's office thinking we're going to admit him, but then they said, well, the business office is going to have to talk to you again.
Though the hospital's own tests revealed that Mrs. Kelly was gravely ill and needed treatment immediately, it asked her for another $60,000 before it would admit her. She didn't have it.
When you have all that thrown at you and then having to sit there and argue about money, not, okay, well, are you going to admit me? Are you going to send me home? Am I going to die?
MD Anderson ultimately agreed to admit Mrs. Kelly for treatment with the $45,000 upfront payment. The hospital says it acted appropriately and that part of Mrs. Kelly's problem was a limited benefit plan, which only paid out $37,000, not enough to cover her medical costs. The hospital says it provides free care and assistance to patients who can't pay. Hospitals say they are dealing with a record number of patients who don't pay their bills. According to the American Hospital Association, uncompensated care cost the industry $31.2 billion in 2006, up 44% from 2000. MD Anderson declined to appear on camera, but issued the following statement. It is a delicate balance between continuing a mission that benefits so many and serving the many patients who need our help regardless of their ability to pay. It is a balance that many healthcare institutions across the nation must address daily, and it is an equally difficult balance for patients who must make financial decisions about their personal health care. In the end, Mrs. Kelly couldn't keep up with the bills, so MD Anderson tried to send her back to her local doctor, Emerardo Falcón, who said chemotherapy was too risky for him to handle locally.
I felt badly for the physicians in that situation because I thought they were put in a position by their business department about it. And the physicians at Anderson that we've worked with have been nothing but outstanding and very helpful to us and our patients. So I felt like they were sort of caught between a rock and a hard place and having to make medical decisions from a whole other perspective.
Mrs. Kelly continues to get chemotherapy at MD Anderson, but billing is still a big issue. She says she could pay off her bill in full, but only if she liquidated her retirement fund, something she doesn't want to do. In New York, I'm Barbara Martinez for The Wall Street Journal.